Okay, hello everybody. Welcome. Thank you for joining us. It's Thursday. This is our third interview of 5 for a series with the Alliance for Benzodiazepine Best Practices. My name is Angie Peacock. I was trained as a social worker, but I'm a psychiatric drug withdrawal and healing coach. I enjoy bringing conversations like this one today. Today we have Doryn Davis Chervin. She's a person with lived experience of benzo withdrawal. I'm going to read you her bio here in just a second. So let me just say welcome, Doryn.
Thank you. So good to be here.
All right. So Doryn is a principal in Chervin and Associates, a public health consulting group. She's a senior public health leader in behavioral and social sciences, program management, strategic planning, and research and evaluation. With over 35 years of progressive experience, she has led broad public health programs in public policy, partnership engagement, program development, social marketing, and health communication. She has worked with leaders at the highest levels of federal agencies such as the CDC, SAMHSA, should I read them all out? Centers for Disease Control and Health and Prevention, Substance Abuse and Mental Health Services Administration, and Health Resources and Services Administration, as well as national voluntary organizations and the private sector to rally around innovations in public health, healthcare, and behavioral health. Doryn earned a Doctor of Public Health degree from the University of Texas Health Science Center. She successfully tapered from long-term use of benzodiazepines. Welcome, Doryn.
That last statement is the best of everything that you read.
I like that. Well, because I'm impressed. I'm secretly, if I had another career, it would be either a pharmacist or a public health because I love that kind of stuff. So everything that I read, I was like, oh, program evaluation. I love that. That's really fun. Social policy. I love that. So welcome. But yes, I would say the most impressive thing on your resume is tapering off of benzos and healing to some extent. That is the hardest,
Absolutely.
right?
Absolutely.
All right, so I have lots of questions for Doryn. She's going to share her story with us. Let's just start there. Can you tell me, how did you come to be prescribed a benzodiazepine in the first place?
Yeah. So I had a very busy, active work life. I had 2 children. And at some point, I had a husband that had gotten into a very bad accident, and it was very taxing on me. I eventually got diagnosed with fibromyalgia and was really dealing with crushing pain, and fatigue and all the things that come with that kind of experience. And I went to my primary care physician, a wonderful internist. And at that time, pain was something that I think at that time it was called like the fifth
Fifth
symptom,
vital sign.
fifth
The
vital
fifth
sign,
vital
thank
sign.
you,
Mhm.
which was you do anything to eliminate it. And so it's a different story now, but I was given Klonopin as this was maybe 25 years ago. I was given Klonopin, and while I was given other medications, that one never changed. I was always on Klonopin, and I had a very hard time managing life and this intense pain, fatigue, trying to be present for work and trying to be present for my family and my community and all the things that we try to do. So that was kind of the reason that I was given Klonopin.
Do you like remember back then when you were first given it? Did they give you any warning, informed consent, anything? No.
I was grateful for something that might work. I mean,
Right.
and that's the problem, right? Is that you're in so much anxiety or pain or discomfort that the promise of something that might work is more pressing than the whole idea that this could have, but nobody even said anything about long-term problems.
Absolutely. And one thing I see a lot is, for some reason, women especially, like they're just giving it over and over year after year. Nobody ever questions it. Nobody ever says, hey, you've been on this benzo 10 years, did anybody ever say anything all these years?
No, not until I started saying to my doctors, I've read some stuff about I'm getting older. I've read some stuff about benzodiazepines. And I was, we haven't gone there yet, but I was like tripping more, falling, balance
Yeah.
issues.
Yeah.
And I felt like I was cognitively fuzzy sometimes. and I was reading about it, and I saw that this was a real hazard. And so that's when I started talking to my doctors. But
Mm.
that never, no, so
Nobody
no
ever
one
said
brought it up.
anything.
I brought it up.
Yeah. Yeah. I hate to say this again. That's another thing I see a lot is just a pattern of women when they reach like either perimenopause, menopausal age. It's something about that period of life when you become more introspective and you start like, maybe the kids have left the house, things are slowing down, you're getting ready for retirement or whatever it is. But I just noticed like middle-aged women, they start thinking like, why am I taking this? It could be, Lexapro or benzos or whatever. So I see a lot of women, our age, like, uh-oh, why am I on this?
Why am I
That
on
kind of
this?
thing happens. Yeah.
Yeah. And it never even occurred to me to ask, why is it working? Isn't it working? What are the other parts of my symptoms that it might not be
Mhm.
solving, but it's contributing to?
Yeah.
Never
So
occurred to me
tell
to
me,
ask.
like, how did that waking up process happen to you? Like you said you were concerned and then did you like bring it to a doctor? Did you start reading online? Like,
I
how did
started
you?
reading online,
Mhm.
and I started getting more and more worried. And then I think it was the thing when I think it's still controversial that benzodiazepines can be related to dementia.
Yeah.
But that whole thought is that I could be doing something that would cause later on dementia scared me. And that really kind of tipped me over to go to my
Mhm.
doctors. And they weren't, I have to say that I never talked to a doctor that I thought was ever doing anything deliberately harming me,
Right.
ever.
Right.
But they didn't necessarily, but it took me a lot to find the right doctors to
Mhm.
go on this journey with.
Yeah. Yeah. So then when you brought this to your doctor, how did that go? Or
So yeah, I brought it. I actually brought it to my new internist. We had moved. I brought it to my new internist, and she said, okay, we can do this. She said, but it's not easy, and that gave me pause.
Mhm.
And then I thought, and I had been on some antidepressants also, and so I wanted to find a psychiatrist that could also work with me. And
Mhm.
I went to find someone, and I deliberately doctor shopped, if you will, to
Yes.
find somebody that would do help me on a very slow taper.
Mhm.
And I had found out about the Ashton manual. I had seen some YouTubes that saw what people were going through. I was pretty scared, but I said, and the psychiatrist I ended up with, he really stuck with me. He didn't really believe that going this slow was the way to do it, but I was really insistent. I said, and that was that really saved me because I wasn't pressured. I didn't feel like there was going to ever be a time where he was going to say, look, you do it this way or not, or
Right.
the highway. Yeah.
So I always think that's the best is if it can be a patient-led, patient-directed taper. It's your speed, it's your body. You're the one that has to feel the consequence. And it's always a little surprising to me, like doctors aren't open to that, but they just as well prescribe, for you, clonazepam for 30 years. But you ask for like, can I just go slow and at my pace? And it seems to be a hurry. Yeah.
It is. And it's I was and if he had changed his mind, I would have found someone else. That
Yeah.
was just
Yes.
and that was I think a saving grace for me because I did it so slowly. And the minute I started feeling anything, or if I wasn't feeling well, I just stuck with the dose I was on.
Mhm.
I was really scared of kindling. So
Yeah.
I never went back on it. But boy, I was tempted so many
Will
times
you
to.
explain that for people that may not know that
Yeah,
term?
so you're in the process of, you're dependent on this medication that you've taken for however long, even if it's more than 4 weeks, you can become dependent. Here
Mhm.
I was years and years, and you're having such a rough time, such bad symptoms in the withdrawal process that you want to go back on or you want to go back up. It's just tempting. Let me go back up. Maybe it won't be so bad.
Mhm.
But I don't know the scientific process, but I know there's a neurological process where
Yeah.
you, that by going back up and down, or changing,
Yeah.
it can just make it so much more difficult.
Yeah.
And you know more about kindling than I
Yeah,
do.
well, it's just basically, yeah, you said it perfectly. It's just, that's when I see the most problems with people that are tapering. It's first, usually they don't know, but they go back to their well-meaning doctor who doesn't understand, and the doctor's like trying to stop the symptoms, and they'll say, oh, well, let's try gabapentin, let's try lithium, let's try Seroquel for your sleep, and then, or they'll cold turkey them off of the Ativan and add it's just like your body does not like all that. Just doesn't. But yeah, kindling is the phenomenon where like there's some kind of healing process happening, and then we interrupt that somehow,
Like
and then
going
it just
back or going on
screws
something else.
going up, I don't know about going like slightly up, like when you're during a taper. I'm
Yeah.
not sure if that's it, but like it's definitely like if you cold turkey and then you reinstate. I mean, I had so many experiences of kindling that it was so scary. But I think that's why that's one of the reasons my withdrawal was so hard, because I had different periods of time where I had like 4 years off of benzos, but then 2 years back on, and then 3 years off of them, and then 2 years back on. Like your body doesn't like that. No.
Yeah. I think that I both read the the kind of scientific literature, but I went on to a lot of websites and YouTube to see what people's experience were. And there were some experiences that were more scary to me than what I was experiencing during withdrawal. And I just kind of listened to that and said, this cold turkey scared me.
Yes, never, don't do
Kindling
that
scared
ever.
me.
Nobody ever,
Yeah.
ever. Yeah, don't do that.
Yeah, yeah.
Yeah.
So,
But
uh,
you're also saying a really good point here about, you can read all the scary stories. I mean, I got 2 emails this morning about, I saw this on YouTube, Angie, can you watch it? And I'm like, if I, I spent an inordinate amount of time trying to talk people off, try to talk people down, because they read scary things online. They read the scary stories. They see some scary video, and it could be somebody that isn't even really in withdrawal. It could be a doctor that's not even educated on withdrawal, but we take that authority and then it scares us like, oh my God. So I think you're pointing to stay in your own experience. Like your experience is going to be your experience.
that's right. And when you're suffering, it's really hard to not want to listen to something that you think or that somebody else says is going to make you better.
Yeah.
And that was, I really listen, I went on to one of the really helpful sites at the beginning of my taper was Benzo Buddies.
Mhm.
Although I have to say it was both helpful because you can find women over 50 that, just
Yes.
every,
Yes.
but some of the stories were terrifying to me. So
Yeah.
I found, I don't know if you found this,
Oh
but
yeah.
I had to, I both got encouragement and guidance from those, but I also got scared out of my mind.
Yeah, and
And
you have to weed through that and have a little discernment, and then kind of check. I think it's really tricky because a patient who's been on benzos and could be a little bit cognitively impaired or a little bit scared or symptomatic, it's extremely hard for you to sort through all that information. And it literally felt like I was getting a bachelor's degree in withdrawal. Like I need to know everything, and I
yeah,
need to know who to trust and who are the players in this and where's the research at and who can I trust and whose word is good and whose is not. And it's so, I mean, that's a lot. That's why I think organizations like the Alliance for Benzodiazepine Best Practices, like Benzo Buddies, Surviving Antidepressants, IIPDW, Intercompass, in coaches are helpful, because we have already wed
yeah.
through that, all that evidence. We have healed, like you and I have healed to some extent. We're almost there. So we've been through the process. We're the experts. I don't like the word expert so much, but I mean, in all intents
An
and
expert
purposes,
in
we
your own
are. Yeah.
experience, certainly. Yeah,
Yes. But like look for those organizations, like what are they saying? They've
yeah.
had years of weeding through the anecdotes and trying to come up with, like what's the best thing that most people can do. And it's helpful. But yeah, it's tricky.
The other thing that shocked me was that you and I could have been on the same medication and have been tapering and we had totally different symptoms,
Mhm.
and our experiences would be so different. And
Mhm.
I was shocked. I thought that it's so like if you have a heart attack, you kind of know what the sequence of
Yes.
recovery is. With benzodiazepine, I mean, I talked to certain people that had terrible intestinal problems. Well, I didn't have that, but I had crushing irritability. I mean, crushing irritability.
Mhm.
And where I think there's a term for it where um, um,
Benzo rage. It's,
no,
it's one of them.
they call it net neural load, I think,
Oh
where
yes, Bernie talked about that on
the
episode 1, and I still want to read more about that. So can you tell me what you know? I
the
want to hear
most
about
I
that.
understand about it is that your capacity to deal with any kind of input, sensory input, so taste, smell, the wind on your skin, the sounds, the smell of tuna fish, not now, but it used to, certain things I would be so on the edge of, like, with just little sensory input. And this was kind of at
Mm,
the worst moments. Uh, but it was that was some of the experiences I had, which was just very tender. I just felt
yes.
like a raw nerve a lot.
Absolutely. The term that I think it means the same thing. It's flooding. It's from brain injury. Flooding is like there's too much stimulus coming in, noise, sound, light, movement,
Exactly.
everything, and your brain just cannot handle it. It's that's the word I always
It's a
related to, but
great
I
word.
never heard of net neural load. I really want to read about that. And that's been absolutely my experience. And that it can change from day to day. Like one day you can handle sitting in a pool in the sun with the wind on your face. The next day you cannot.
Exactly.
Very
Exactly.
strange. Yeah, it's very
And
strange.
one of the problems that this was a personal part of my own psychology, is that I didn't want I felt like I needed to just keep working and to not let people know what my experience was. And so I hid a lot of this from kind of work environments. But then I
Mhm.
would come home and I would say that my kids did not get the best of me.
Yeah.
My husband didn't get, I would go to bed. And, that was, but I somehow in my head thought that if I just keep working, that I could uh, not hide through the experience, but at
Mhm.
least I kept part of who I thought I was in that
Yeah.
experience.
Yeah, I think part of that is also like a good coping or a survival method. Not everybody, like, let me just say that for the audience, because there's people out there, they cannot work. It's like
Of
impossible. There's no way. They're way too sick before their taper started or
course,
whatever.
of
But I
course.
think some of us, like, you'll hear, because I hear hundreds of cases at this point, but some will say, like, my symptoms are so bad, I cannot sit down, or I am so much energy in my body, I have to do something. So people like that will be able to pull it off. I don't know how they work. I'm like, I can't believe how you're so symptomatic, but you can function to some extent. It's a good distraction for them. It's a survival. They have to, in some cases, not like with severe akathisia or something, but they
Right.
need to keep the money for the family or they're going to lose everything. And they make it until they can't, so there's lots of reasons people, you know, uh, I just think we're all different and our tapers are different. Everything, our experiences are so different. But yeah, I'm so
Absolutely.
glad. I'm so glad you kept that functionality because you had a self-directed taper.
Well, and this was even before I started tapering. I was
Mhm.
struggling and wasn't even sure that it was the I didn't even think about it as being the benzodiazepine, but I was not doing so well.
Mhm.
But even when I started tapering, I tried to work. And there were times where I would just take days off. And,
Mhm.
but that was how I did it. But boy, I've now with the Alliance, and we could talk more about that, but
Yeah.
I've talked to folks that are committed to dealing with benzodiazepines, both in their own lives and in terms of the community or changing health practice, but they can't function, period.
No, it
The
cannot.
impact on their family
Yes.
is just it's crushing
Yes.
in some certain cases.
It is. So let's take me through your taper. How did the taper go? How did you figure out how to taper? What rate? Like, give me because people in the audience always want to know that. Like, how did you figure this out? Like, how did you taper? How long did it take? And then what was your experience like in your healing process?
So I took 2 years. And I when I went from like 1 milligram to a half of a milligram of Klonopin, I did that through just cutting the medication into tiny little bits and getting
Hmm.
smaller amounts. I tried to, I looked at many different ways that people did water tapering, and I thought, didn't trust myself, that I felt like I was struggling with so much, that how could I get the precision of water tapering? So when I mentioned I talked to a psychiatrist, I talked to him and I said, when I hit a certain point, I really want you to give me a prescription for a compound pharmacy where I could, for people who don't know what that is your medication instead of a pill form is in a bottle with a dropper. And I could manage that. I could, and so that was how I went down. And some weeks or couple of weeks, I could go down consistently, and others I had to just stick with it until I was ready. And but boy, that was how I did. That's how I accomplished it. The scariest part for me of the whole thing was when I was almost down to nothing, but I went to jump. I somehow, to me, that was terrifying. The idea of not that it was doing anything at that point, but that was
Mhm.
a big. But then I did it, and I have to tell you, it was it was nothing because I was down so low. Now I don't know that that's a case for everyone, but that was a
Yeah.
pretty
So did,
that intimidating for me.
so you said you followed the Ashton method. Did you do like 10% a month, 5% a month? How did you figure out the
That was how
calculation?
I originally started, and
Mhm.
I tried to do 10% a month. But again, if I could do it, I did. But I never did more than 10% a month. I just
Mhm.
thought it doesn't matter if it takes however long. I would, but again, if I wasn't doing well, I stuck with it. I held. Is that what you call it? You hold,
Yes. You hold.
and then I would just keep going. But I tried to do. But again, I did. It took me close to 2 years.
Wow. And this is a question I ask a lot of people. I'm wondering your opinion, but how did you know? Like, I think part of the process is you learn your own body and like you learn, okay, time to cut. For me, when I tapered Cymbalta, I can't explain it, but it was just like, I just felt it like, okay, time to make a cut. So how was that for you? Like the learning process, like learning when to taper and when to hold, like that listening in, you know what I mean?
It was more like I didn't feel good. I didn't feel right. It was I felt scared of the next cut, and
Mhm.
I kind of tried to really pay attention to my own intuition about this.
Mhm.
And what I had felt like I had to balance was my desire to get off this horrible medication. Oh, for me, it was horrible at that point to get off it and get rid of it versus, which is tempting, versus just keep doing, keep slow and steady. And there was no, I just tried to listen to my own body.
Good. But I mean, another point here is a lot of people say, like, Angie, I just want off of this. I don't want to take it no more. I want it out of my body. And I always say, okay, I get it. Slow down because you have, like you said, you have to balance. I need this out of my body and I want off of this. But if you do that too fast, I mean, it's not good. You know what I mean? It's not good. So it's always a balance between I want off, but do that safely and, for your own pace, what you feel is right. But that's a huge.
But I really paid attention to other people's stories and and the mistakes they made. And at least I tried to not make those same mistakes. I made plenty of my own, but but I at least tried to say, okay, that's really good advice. I don't want that to happen in my life. Let me see if I can avoid that. So that was
And the
important.
fear though, like some people say, I'm afraid to cut, I'm afraid to start the taper. And I always say, like, I can't take the fear away from you. It is scary. I was afraid. But it's almost like for me, I felt the fear and I had to do it anyway. You know what I mean? Like it's here, I'm scared, but like I don't feel good. And my healing is on the other side of this. So how did you work with the fear of the whole thing?
Um, I just lived with it. I thought,
Just
I
there.
coexisted with the fear is how I feel about it. I
Yeah.
often feel that way about I might be afraid of something, but it doesn't I can't live my life in my mind let fear drive it. So I
Yeah.
thought, okay, I'm gonna just coexist with this fear.
That's good. I like the way you said that.
And
Good.
that was kind of how
Yes.
I thought
So
about
then, so then you came to the day you jumped. And I remember the day, first of all, my taper did not go as well as yours did, but the last medication I took was a beta blocker to try to help some of my symptoms. But I remember I skipped a dose by accident and I was like, oh, I was tapering it. And then I realized, oh my gosh, I'm off. Like that is a scary moment. And I know you and I want to talk about identity, but like my identity was taking medications for 13 years and going to doctors and talking about my anxiety and talking about my symptoms. And
Yeah.
my whole life had revolved around the tapers and getting off, and now withdrawal. So like talk to me about, identity. Like, how did your identity change through this process, through your healing process? Yeah, identity.
So, when I was on this medication, I just kind of thought this, I'm who I am, and then when I started seeing, and I thought, if I stay on this, I'm going to lose who I am. I'm going to fall and hurt myself. I'm going to not remember things. I'm going to be impaired. I just was, that was more frightening. And so I just thought, I'm going to get off this stuff. And then when I was on it, I wasn't used to being so impaired. I wasn't used to feeling so horrible. I wasn't used to feeling so I can't, irritability, which I still have some of it. My husband can attest to that, but I can, I was ashamed of the symptoms I was having and how the person I was becoming. But so I tried to deal with that, and the identity issues were also about working. I always had been a working person, and when I was not was when I wasn't feeling well and I couldn't work, I just struggled with that. It's not like you get a bug and you feel, you don't care about it. You just, I got a bug, but this is something that and maybe it's getting kind of owning that you have a chronic condition,
Yeah.
and that you have to kind of own it and say, I have to tell you, a year ago, my granddaughter a year ago tomorrow, was diagnosed with type 1 diabetes. She was
Wow.
8 at the time. And our family has had to deal with the whole issue of uh, who was she and us then, and who is she and who are we now with a child that has this chronic condition. And that's, and somewhat, I think that's kind of I'm never going to be the same as person as I was before, but I am who I am now. And
Yes. Yeah.
and that's good because I'm in a good place.
I like that. So I want to talk about that more in just a second, but I'm thinking let's lead up to it in a way, like when you took the last pill, what was the healing process like? Did you have symptoms that lingered? How did you manage how you felt? And then we'll talk about that in a second, but how was that healing process for you when you were
Well,
finally off?
there's a magical thing where you think, if I'm finally off, it's all going to go away. I'm going to be better. And of course, it's not like that. I think that's the thing that's strange, is that you think, okay, I have done this so slowly, and I'm finally off. And I also, because I then was working with the alliances, I'll talk about that in a minute, but I also, it just surprised me that I still was struggling with lots of symptoms, and the sensitivities and the irritability and I had increased pain for a while. And I had insomnia for periods of time. And I have to say, Clonopin, if it didn't help with anything else, it helped me go to sleep at night. And then, so
Mhm.
that was an adjustment. Um, I think I lost your question in terms
Oh
of
yeah, it's okay. So you
feeling
you took me
identity.
you took me through that. So I think at a certain point you start to feel better, and then you start thinking about different things than withdrawal or your taper. And I think that starts to transform. We don't talk about this enough in the community, but you kind of like figure out things about your life. Like for me, I was like, wow, I made all these decisions. Like I was impaired making these decisions, but I didn't even know how impaired I was until I was off and I looked back. But then you try to think like there's a grieving process, like all the years that were different or that I didn't get to live, or because I was chronically ill. And now what am I going to do with this experience, or how am I going to move forward? Who am I now? What am I rebuilding? I have a lot of people that are like, let's say for some of the more severe cases, let's say like 3 to 5 years off, and they're like, Angie, I don't even know who I am. I've been on medications for 30 years. I raised children, and now I'm like in my retirement years and I'm off this medication. Like, I don't even know who I am. And it's a heartbreaking process to me, but it's also exciting because you do get to do something with the experience if you choose to, or not. You can leave it behind and God love you, move on, you know? So like, tell me about that, like that part, like the meds are gone, my symptoms are slowly resolving. I know you've done some advocacy with the Alliance. Like, what did you take from that experience? What did you learn?
Yeah,
Like,
so I'm glad you brought up the lines, because so in public health, one of the main opportunities about public health is that you get into prevention. And so that's the whole thing. If you can prevent something, then you're really solving a social problem. And I thought, well, how is this happening that I could be so, that I and so many other people could be affected. And so I looked into like who was doing work in this area, and then I found the Alliance for Benzodiazepines Best Practices. And I thought, you know what, if I'm feeling better at all, I'm going to put whatever energy I can into contributing to the organization, because I like the idea of trying to change uh, that change providers prescribing so that they wouldn't unnecessarily prescribe these to patients who would then go through the same thing. There had to be a solution. And so I found strong supports for my identity in that. I found that I was able to contribute in ways that I would have never been had I not been exposed to benzodiazepines. It was gave me a purpose. And maybe that's what it's all about, is finding out, well, do I have a new purpose?
mhm,
And that was very, very helpful to me. I mean, I'm sure that as you find purpose in
yeah,
coaching and the work
yeah,
you do,
yeah,
and it's still in the area, but it's positive. And you know, I I don't mean to sound like a Pollyanna, but that was what worked for me.
yes, I like that. I found that too, that I have to do something about it. And
Yeah,
I think yesterday, who was I talking to yesterday? I think it was one of my clients, but I said, in a way, this is my justice. I get to help other people that are trying to get off and leave and heal, and I get the gift of watching them heal. It's horrific, the suffering part, but that's kind of, I'm channeling my energy, my grief, my anger about the situation that happened to me into something more positive to help other people, you know?
yeah, yeah.
Yeah, it's
And
good.
I think the other thing is, the thing about anger is that things, I don't think life is fair. I don't think it has to be fair. I've rarely seen it be fair. And so I kind of gave up on the idea that this was unfair. It just was.
Yeah,
And it's what I was able to do with it that was meaningful to me.
yeah, yeah.
I felt that the unfair part, well, I was going to say the unfair part was maybe how it affected my husband
Your whole
or
family.
or my family. But honestly, you know what? Again, that's not fair either.
Yeah,
And
yeah. So I don't know if you have this experience, but again, this was a conversation yesterday, same thing, but same person, but we were talking about like on this side of healing though. I'm not to say that it was worth it, that I would not wish that experience on my worst enemy ever. But now I live like I'm a better version of myself. I don't think it would have come any other way, unfortunately. Like just the level of suffering has given me the ability to love more and be more present and be more grateful. And so now I'm not like so much living in the anger of what happened. It's like, no, we have a very short time on this planet and I want to live as fully as I can right now, like this second. And it's almost automatic. I'm not like, oh, let me be in the present moment. No, my brain is like there all the time, you know? And I almost say like there's not enough hours in the day because all the stuff I want to do and I have to do. And like I'm not, let's go live.
so,
So how has that been for
when
you?
I really knew that I was better, and this didn't happen right after I jumped, this happened probably a year after,
Mhm.
um, I was able to travel. I was able to make a plan because there was some place I wanted to go, get in a plane, go there, enjoy it or deal with whatever it was. And that was, for me, that was huge. That was a huge sense that I was okay. I was okay.
Love it. That's
Yeah.
great. I'm so glad. I'm so happy for you. All right, so let's move into the Alliance stuff. So can you tell me what is your role at the Alliance? What have you
Yeah.
helped? What's going on? Tell me all the good stuff.
Yeah. So again, I found so a way to make sense out of all this was to do some work with the Alliance. And I was still working. I'm now kind of coasting into retirement, although I'm not sure that's ever going to happen for me. I'm not sure that's part of my psyche, but So I'm on the board of the Alliance. So what I like about the Alliance is there are lots of good organizations that deal with supporting people that have been injured by benzodiazepines. But what I liked is that it was different about the Alliance is that it was really focused on stopping the problem at the source, cutting the problem off at the knees, whatever you want to say. And some of that is by doing, education with healthcare providers. And so there's, I don't know, 4,000 healthcare providers that have been trained. But the part that I really love is the policy work. So I head up the policy work, which is, it's trying to change systems that that kind of allow for something to happen. So I know you're a veteran. The VA is doing amazing things about dealing with benzodiazepine harm, and they don't just do education for their providers, but they put in like stops in the electronic health records so that a provider who might not be thoughtful about it or be thinking about it says, I see this here and it says, don't do this for more than 14 days. Well, maybe and so one of the things that we're doing is we're working with some federal agencies like FDA and others to work with them to improve, not just put out black box warnings that we know are out. There's 3 out in benzodiazepines just in the last 5 years, but there's ways of promoting safe use, and that's what we're excited about with them. I've been really excited about identifying healthcare systems that are kind of doing the right thing. And again, it's not just saying I'm going to teach the providers, the doctors and nurse practitioners and physicians assistants to do or not do, but it's putting in stops so that when they go to prescribe, that there are the right questions asked, that prescriptions are not 90-day prescriptions, but are maybe 14-day prescriptions.
Right.
That there's a plan for what to do when those 14 days are up, that person gets supported in, with whatever anxiety or sleep problems they have. So we're also working with kind of all aspects of the healthcare system, the benefits packages, the pharmacy plans, so we're really trying to change all of those so that the systems begin to support the patients and the providers in the right decision making. And also the most recent thing is I'm trying to work around getting legislation happening in different states. It's very slow.
Oh, yes.
But if there's anybody that is interested in helping with that and sending letters to their legislators, Colorado has done some really cool things around legislation for prescribing limits. And I live in New Jersey now, and so I'm trying to build that into what's happening here.
There was somebody in New Jersey, oh gosh, I'll connect you to an email. She was trying a couple years ago. So New Jersey, Massachusetts is on like its 4th year. I testified 2 years for Mass.
Right.
Colorado, I'm friends with all the people in Colorado. They're doing great work there. Senator Porter in California, she doesn't know, but we're coming to knock on her door very soon because she's open to pharmaceutical industry corruption a little bit, but I don't think she recognizes the mental health aspect of that side. But yeah, that's good. I also think part of my healing was advocacy and activism and like, how do I help change this somehow? So that helps. That makes me feel good to hear about the VA, because I was in touch with their Benzo team a couple of years ago and they seemed really excited, but they were busy, and I even read their back then I read their clinical guidance and I was shocked. Like, they had one of the citations was Malcolm Ladder's work, but they didn't use Ashton. And then but the way that they did their tapering protocol looked like Ashton, but it was a little too fast. And there wasn't room for that patient-directed taper, which is always my worry. So I'm going to ask you this, because I asked this of Bernie, but on the policy side and on the systems change side, is it being advocated for patient-directed taper?
100%. 100%.
That's
That's what we're advocating for. One of the things I've learned about working with certain medical societies is that there's a concern that there's any policy that's going to affect what doctors' discretion is. And we're not in any way, shape, or form trying to say that benzodiazepines are bad for everyone, or that that physicians shouldn't have shouldn't be able to prescribe them, not at all. But what we're trying to say is just prescribe for 14 days and then have a plan to do something else. That benzodiazepines have a place in medicine, but they can be incredibly destructive, and they're very destructive to many of us. And but I think that some places, some medical societies get worried that we're going to take away doctors' discretion.
Yeah.
That's not what we're trying to
And
do.
I saw that in Massachusetts, a lot of the Harvard doctors showed up one year, and it was almost like, don't tell us how to practice. They were very threatened by that. But then during COVID, we saw that happen, not to bring COVID into it, but they were being told this is what you're going to do, and don't stray from that. My fear is always, especially in older patients, and I hate to even have this discussion with people, but it's just a matter of time before a doctor sees you're on a medications on the Beers list, your doctor dies or retires, the insurance company stops paying, the hospital takes it off their formulary. I don't know when that's going to happen for any of us.
Terrifying, right?
It's terrifying. Okay. So I always say, like, it's your best interest to get a patient directed taper on your own terms as soon as possible. Because I get scared. Like, I know Bernie said 2025. I'm not trying to scare everybody in the audience. I'm so sorry. I'm not. But I don't want to see happen to benzo patients what happened to opiate patients.
Exactly. Exactly. And, there's a pendulum. And like I said, when I started um, on this benzodiazepine journey, and I was prescribed opioids at the same time, but I never took them. It wasn't, I was kind of afraid of them. But at that point, can you imagine if I had taken benzodiazepines as consistently as I had, and then I'd taken, now we know that there's a real danger, like 30% of opioid deaths have benzodiazepines on board. So that's,
Mhm.
but so when I started 25 years ago, pain was to be eliminated, and anything you could do to eliminate it. And then now we know about opioids, and then there's like a swing, but the swing is a societal swing, but people get caught in that. And what we don't want is people to be dropped off.
Yes.
We don't want them to, and also we don't want providers not to prescribe something and then not do anything else.
Right. Or
Exactly.
even like people that are in their 60s who've been on for 40 years. If they don't want to come off, leave them alone. I know VA, I found this when I was doing research for my master's degree, but VA did like what was it? What do they call it? Oh, an inspector general report where a patient had died by suicide because he was being taken off his benzos after like 40 years, and he didn't want to come off. And he was like, leave my medicine alone. And they took him off cold turkey. And then he ended up in the hospital a couple times, and then he completed suicide. And the recommendation from VA was patients that are on long term should be given the choice whether they want to come off or not. This patient was doing well on the medication. He was fine until you cold turkeyed him off. And then look what happened. So that's an extreme story, but obviously that was the subject of an IG report. But that's my other thing I advocate for is, like, if somebody wants to be on it, and it's horrific when people are in their 70s in withdrawal. Like, that should not be happening.
And there are many.
Many,
There are many.
many.
Yeah, and if you look at the data on prescribing, the biggest numbers of prescriptions tend to be, now I'm not 100% sure about this, but tend to be like middle age, 45 to 65, and or and I should get those exact numbers for you, but there's just a big hump of people that are going to be dealing with this. Now, there's some good news. We have what we're saying is that some of the newer doctors, some of the younger ones that are just coming out of training, they tend to be that steer clear of benzodiazepines.
Yes, they're a little bit more educated. And I've noticed actually a lot of the clients that I see, they have good doctors when they're younger, and they're right out of school. They're more open-minded. They haven't, had the years of experience, like lose their empathy a little bit. They're more willing to listen and work with you. So yeah, doctors or DOs or NPs, PAs seem to be a little bit more open-minded than the MD, the older MD. Yeah.
I wanted to say something. There was something that you said that struck a chord, which is a lot of times when you are first being prescribed a benzodiazepine, you are either terribly anxious or in pain or can't sleep.
Yeah.
And so you might be offered a benzodiazepine. when you are in that situation, it's very hard to say, oh, what are the long-term effects? Because you're feeling so horrible right now that I think a lot of times all you could see is, how do I get rid of this terrible experience? But so it's very, the whole idea of informed consent is so important, but it's very hard to give consent when you're miserable.
Well, and could anyone have given you consent that you would have understood that it could take you 2 years off to taper off this drug, and that you're going to feel really, nobody can give, I don't think that's possible. Like, for instance, I always use this example. It says dizziness on the pamphlet. Okay, the level of, I thought that meant, like, when I read that on the drug, I thought, oh, I'll just be lightheaded, just get up slowly from your bed.
But not that the
No,
room is spinning, you can't
yes.
move. Yeah.
You mean I can't walk to the bathroom, and like, my analogy is I'm walking in high heels on a tightrope across the Grand Canyon. That's the level of dizziness that I had. It was not a little bit of lightheadedness. So could I have been given informed consent to let me know that that happened, or would I have even believed that? I would probably laugh, because I don't have any frame of reference to understand that,
Yeah.
So I know we advocate for informed consent, but I always think, like, is that even possible? Because it's just, I don't know. All right, so we have 2 questions for you from the audience. How did your psychiatrist react when he saw that it took you 2 years to come off, but that you were successful?
Um, I think, yeah, this is such a great question.
Isn't it? That's a good one.
I think he's still even skeptical that it would take that long, but I didn't care, as long as he would work. But he just kind of believed me. He just, I brought in like articles from the Alliance or from other places that were reasonable, and it talked about patient-centered, and how did he react? I don't think he saw it necessarily as, I'm going to take it back. He did think it was a good thing, because he knows how hard it is to get people
Wow.
to taper. But I mean, maybe I just dealt with him for such a long time. I just assumed that he was continued to be skeptical. But even, I haven't talked to him in a while, but I think he must have been proud. I would hope. The question is, would he do that with
For
somebody else that
others.
was
Yeah.
wanting to? That's my question. Is would he help somebody go off it really slowly on his own?
Yeah, I always wonder about the impact of our work on others. So, or like what you said to your providers, did they really get it, or did they translate that to practice? That's always my question too.
Yeah.
All right, here's the next one. What about the trend in some states that are advocating for legislation to allow psychologists to prescribe? Note, yes, I was totally over prescribed by psychiatrists, but maybe psychologists can help with tapering.
Well, aren't those 2 questions? I mean, the way I hear it is 2 questions. One is, I think psychologists could be very helpful with tapering, because, but I don't have a point of view about psychologists prescribing, but my first reaction is, I don't see why that would be helpful. Maybe I'm missing something, but why
Yeah.
is it helpful to have more people prescribing benzodiazepines?
Right. I think there's a move because there's an MD shortage nationwide,
Okay.
that some states are advocating for, like New Mexico is one of them. I met one of these guys though, that was already given provisional licensure to prescribe. And we showed medicating normal, and he pointed at the screen and he said, the stories that you just saw, that's very rare. And the whole audience laughed, and they said, and then I talked after him and I said, if it was so rare, they wouldn't have made a movie about it. Like, no, it's not rare, So it doesn't matter to me what, if you're an NP, an MD, a PhD, whatever, there's no training for this right now, except for what the Alliance is doing, and even Bernie said only 10% of the 4,000 doctors actually put this into practice.
I think 10 or 20, but yeah, and it's a so the question is, if we want to train psychologists or social workers or any mental health professional to help with tapering, that is fantastic, because the more people that really can help all of us go through this experience, that would be ideal.
Right.
Who was also was helpful to me is my pharmacist.
Yeah.
Not not that they could change anything, but when I talked about my symptoms and should I, they were very, very knowledgeable. And, but so I don't really have a point of view. I don't know enough to say, should psychologists do it? But unless there was, I need to understand more.
Yeah, that's good. That's a good answer. Okay, so I'm gonna have two more questions for you. One is, that's the end of the audience questions. Okay, how do you think benzodiazepines and withdrawal is impacting public health in the United States?
Yeah. So that's a great question. I think that benzodiazepines are an unknown contributor to some of the huge problems we're having in the area of suicide prevention, in the area of opioid deaths and substance abuse disorders. I think that that if there was a true understanding and commitment to changing, for instance, opioid issues, we would look at a benzodiazepine strategy. If we had sufficient money to deal with all the issues involved with suicide prevention, we would look at the impact on of both taking benzodiazepines, but also tapering and all it, because for some people, the the tapering process and the symptoms are unbearable. And it's at that moment that people are, they want to stop the pain. And so I would hope for a more robust approach. Benzodiazepines are not the only issues, obviously, but they're certainly something we know about and we can control. Anna Lemke, who wrote in the I'm sorry, New England Journal of Medicine, she called it a silent epidemic.
Yeah.
And so to me, that's a huge issue. We haven't talked much, and we're running out of time, but about COVID and benzodiazepines. And I don't know much about it, but I think that that's
An
something
increase.
that needs to be
Increase. I think
considered.
I've already seen clients come to me to say, I got so anxious during the pandemic that I went on a benzo. I was on for a couple months. I started getting symptoms. I asked my doctor, how do I get off? He didn't get it. Now I feel trapped on this medication. How do I get off? So I think the impact from just COVID anxiety, you know what I mean? Just we were all terrified collectively, So I've only seen a couple of those people, but I'm sure they're all over the boards and in the Facebook groups coming off now, hopefully, because the
That's
anxiety
right.
has eased a little bit. But yeah, I also think impacts are on public health are disability. Like,
Yep.
people are having to go on disability,
Yep.
break up of families, divorces. I see all this stuff. People have to move back in with their kids, they lose their job. Like, it's severe for a lot of more people than I think we even understand. And I don't think I see anybody doing like research on the outcomes of benzo prescription and tapering. Is there any?
That's there's I'm not sure. I have to look at that, and I could certainly get any information about that. But I think there are occupational issues, so like what happens if somebody's working in an occupation and they're impaired by a benzo and they have, what happens if somebody has a benzodiazepine and they can't manage their family.
Yeah.
There is an overarching set of issues. But if you're in the middle of a taper right now, or you're struggling, or you're even having bind at this point, those are really hard issues to wrap yourself around. But when you begin to feel better, you can put your attention to some of those issues.
Totally. And we're going to end on hope. That's my last question.
Okay.
I always end on hope. I feel like I should name these videos. I was thinking about this the other day, like I need to name for my podcast or whatever these videos are. And I'm like, I think it should be ending on hope, because I always try to do that. Is like, first of all, your story and your work is amazing. Like you went through this, you took the bull by the horn, so to speak, and you said, I'm going to taper, and if I'm going to do it my way. And that I think is like number one for people to do. And then you did something with the experience and channeling all that, frustration, or you wanted to help, and you're doing it. Like, I'm so happy. Like, just the thought of you knowing even the scary stories, you weren't one so scary. Like, you didn't read, you weren't the scary stories that you read about, but you have those in your knowledge base. So when you're advocating on FDA or at SAMHSA,
Exactly.
the breadth and depth of this problem. And to me, there couldn't be a better person doing that. How hard it can be for people. We need people like you advocating for the others that can't,
Yeah, absolutely.
So I really appreciate that myself. So let's end on hope, like hope about healing and hope about policy change and systems change.
Sure. So I took my very last milli whatever of Klonopin 2 years ago, and I feel like a complete person. I feel like I can be engaged in the world. Some people take much longer. I totally get that. But all I'm saying is that here I am 2 years later, not that I still don't have flare-ups of this like irritability or the incredible sensitivity, but I feel like I feel like a good person and I can engage in the world. And what more can I say about than that? And I wish that I hadn't gone through this. I mean, but I can't change that. I can only change, how I think about this at this moment.
Mhm.
With policy, I think that it's very promising that FDA has put out these boxed warnings. I think it's very promising that there are healthcare systems that put these stops so that a provider can't just put in the electronic system 90 days of medication. They can only put in 14 days. Well, that's a kind of there are things that are happening, and there's a lot of people that are more and more committed. And I would just say for folks that are tapering, if you have a minute of energy, write your legislator. I can send you an example letter to send, or, whatever you can do, try to find a moment to kind of lift yourself up. But believe me, I totally get when those moments are just invisible.
Yeah. So any hope for like what's coming down the pipe policy wise, FDA, the Alliance, SAMHSA? Can you talk about that really quick before we go?
Well, all I know is that there's a lot of people that are now working on this. There's a lot more attention, more people understand, fewer and fewer of more of the younger doctors, as we've talked about, are being much more cautious. um and I think that there's enough moving parts now that between what the Alliance is doing and other advocacy groups and the mental health and behavioral health groups, that we're going to see some change. Is it going to be fast enough? I don't know, but I'm optimistic, and I think you are doing an amazing job with these conversations, with the work you do, and it takes all of us to
All of
to
us,
make
yeah.
this solving this.
Yeah.
So thank you.
Thank you, Doreen. Thank you for your work. I just always I love talking to you guys at the Alliance. It's amazing. It gives me more hope. Like, oh, thank God it's changing. Because you feel like you see all the problems, all the issues, and you're like, I want to do everything, and you can't. It takes a village to change these things at systems, at individual level, at familial level, at community level. There's so many different levels to it,
100%.
All right. So thank you for joining
you.
us. Thank you in the audience for watching. Thank you for your questions, for your attention. For the next interview, wait, who do we have next? Hold on, let me scroll down. Oh, next is Alexis Ritvo. She's the MD, MPH. So she's a doctor who helps people get off of benzos. She's very instrumental in the Alliance for Benzodiazepine Best Practices and the Colorado Consortium,
Perfect.
which
She's
is awesome.
excellent, and I would urge everyone to be there and to ask questions. She's one of the most knowledgeable people in the country about this.
She is. I can't wait. Okay, well, thank you, Doreen. Thank you for
Thank
joining us.
you.
I hope you have an amazing weekend. And everybody out there, thank you for joining us, and we'll see you next week.
Bye-bye.